時間就過咗2點半，不過咧啱啱我哋已經亦有足夠。
It is the appointed time, members, and we have a quorum. Let me call the meeting to order. First, let me wish you a very happy New Year, since this is the first meeting of the panel in 2014. Now, item 1 on the agenda, confirmation of minutes of a previous meeting. This is about the meeting held on the 3rd of December 2013, and the minutes have been sent out on the 3rd of January this year. The clerk has not received any proposals for amendments. I'd like to ask members whether you'd like to propose any amendments now. If not, can I take it that members confirm the minutes? Thank you very much. Item 2 on the agenda. Information papers issued since the last meeting. There has been none. Item 3 on the agenda. Date of the next meeting and items for discussion. The administration made certain proposals. 3 of those had to do with financial arrangements. They would like to seek our views on those items. Number 1, installation of electric locks security system at Thailand Center for Women. Replacement of a crash fire tender for the airport fire contingent. Number 3, proposal to write off a judgment debt. This is for us to comment on. And then there is another one. Immigration arrangements for entry of mainland residents for family reunion. This is a discussion item. Earlier on, we heard the concerns of members. Who was it? There was a referral letter. Recently, we can see a lot of concern about this matter. So we have this item as well for the next meeting, immigration arrangements for entry of mainland residents for family reunion. Members, any views on the agenda? The next meeting will be rather special. This is because in January and February, we would have a lot of meetings. As you know, we will have the policy address. And there is a special arrangement about the policy address briefing. It used to be an hour, but now it has been lengthened to 1.5 to 2 hours. So our meetings are getting longer. And then also there is an annual report from the Commissioner for Police on the crime situation in the last year. He would be reporting to us on the security situation vis-à-vis the crime figures. He will go to the Executive Council first, and then he will come to us before he holds a press conference. The same will happen this year. That will be on the 28th of January 2014. He will come to us in the afternoon, but again, it is going to be special this year. Originally, the time would be in the PM, but it is going to clash with another panel. It is the development panel, which has a big membership. And the development panel will have its PA briefing at 2:30 as well on that day. Could I consult you members here what the arrangement should be? Suffice it to say that we are going to have a number of meetings in these 2 months. So let's come back to the next regular meeting of the panel, which will be held on the 7th of February. I read out 4 items. Any ideas, any views? If not, let us endorse them. Thank you. Yes, Mr. James Toe. I have some views, actually. These are rather minor items, let's say. I don't know. For example, the installation of electric locks security system at Thailand Center for Women. We are only talking about one center, and how much money are we talking about involving the installation of electric locks? Actually, we have many items that we would like to discuss, and then you are going to replace a crash fire tender for a particular department, but there are so many departments. I think they can circulate a paper, and if there are not particular questions, do they want to discuss them at the meeting? Well, Deputy Chairman, you might have discovered that every time if there is a funding proposal, I would put them last. Usually we would have 2 agenda items and then we would tag one of these at the end because we don't expect to spend a lot of time on them. Why is it that this time around we have one main item, the immigration arrangements for entry of mainland residents for family reunion? The others, as I said, can take very short time, but if members are interested, they may take a longer time. And it's hard for me not to put them on the agenda, but experience shows that indeed, as you said, we could circulate papers and for members' comment. But then this time around, the money spent is going to be of a large amount, so the administration would like to come to the panel. Chairman, say, for example, I'd like to discuss the carry-on video recorder on policemen. It has a big impact on people's privacy. It is now purchasing them on a large scale. They are not being tried out as such. So if the administration puts a lot of these items on our agenda, then maybe we should hold a special meeting. We should not just respond to the proposals of the administration because we would like to propose items, also because we are supervising the executive. But did you put this on the list of outstanding items for discussion? No, Chairman, I am raising it now. Okay, yes, of course. I was also thinking whether we could take up the items proposed by the administration, for example, the one about immigration arrangements for mainlanders. And we would, of course, have to find a convenient time for items in which members are interested. So you would like to discuss that? Well, yes. Let's find the time to do it. But if the installation of electric locks at a center for women will take up an agenda item, I find that strange. If that's the case, I can always come back with funding proposals. No, but if you have been following my approach, usually we have 2 agenda items plus 1 funding proposal. But if you have raised this, let us see whether we can also include your item in the upcoming meeting. Any other views? Mr. Leung Chi-Chang. Actually, I share the view of Mr. James Toe. Frankly, there are items raised by members which are put at the back of the list. So I rather say that if there are urgent items proposed by members, they should be given priority. If the administration's items can wait, I don't think you should allow them to jump the queue. So, Chairman, you have to make the assessment. Are they really urgent? Also, Is it that I can refer to the list of outstanding items? Yes, indeed. I'd like to raise one item. In 2010, in Tin Shui Wai, there was a project conducted by the police, but it came to nothing at the end. At that time, the district council and district organizations gave it huge support. And because it was very helpful in preventing crime. I remember in the 2-3 years following that project, the crime rate fell. Now, I don't know whether this was discussed at LegCo because I was not here at that time. If not, I'd like to know why this project, which is so good, had come to nothing. Is it because it was considered a waste of police power? And the police preferred to make use of high-pressure tactics to prevent crime. So I'd like to have that discussed at the panel here. I'd like the police to give us a report. Okay. Mr. James Toh. Earlier on, in Taiwan, there were sex crimes. There was 1 or 2. And the police officer waited 6 days to release the news so that there was a second incident. The police should be asked why they delayed the dissemination of the news and what criteria were applied because people's safety was put at risk. So this is about timely and appropriate release of crime information. Well, when the CP comes, we can put this to him. Oh, yes, please. Ask him to write a short paper on this. Any other items that you would like to list on the agenda for the next meeting?
We can make arrangements with the administration to discuss. If not, let's see if we can add an extra item, as mentioned by Mr. Toh. Then we'll come back to the special meeting on 28th of January. The Commissioner of Police will report on anti-crime in the last year. And since there's an overlap with the development panel meeting time, so we can hold both meetings at the same time slot, but there'll be a significant overlap, or the Secretariat has liaised with the police to ask them to consider to meet at 12:30 to 2:30. Well, why can't we hold an earlier meeting? Originally there was a time and slot at 10:45, but the Commissioner couldn't attend because he needs to report at the Executive Council, so he can't attend at 10:45. And at 4:30, there's also a press meeting, so we only have this time slot. We could convene at 2:30, but it would overlap with the development panel. So I'm inclined to change the meeting time to 12:30 to 2:30. Otherwise, we would overlap with the development panel. And we have a lot of development panel members here. Any questions? If not, then I'll confirm the meeting time, the meeting with the Commissioner of Police on 28th of January, 12:30 to 2:30. Okay? Then we move on to agenda item number 4, drug treatment and rehabilitation services. Before we invite deputations, I'd like to mention we had discussions on this topic, and we felt that professional bodies have different views, so we had decided to invite the professional bodies to provide their views. So with your agreement, there are 6 bodies that have been invited, and 2 of them cannot attend. The Family Medicine and the Bar Association cannot attend. Family Medicine cannot attend, but they do have a paper for our reference. So today we have 4 professional bodies attending. Just now I received an email saying a deputation called the Community Social Workers Front. They have a request, and there are also other non-professional bodies, frontline bodies, but our decision on the last occasion was to hear the professional bodies, and our own social workers have already provided views, and I just want to report back to you. If we have professional bodies, registered bodies, they will allow them, but if they're just a concern group or frontline group, I have declined their requests, and they can submit their views in writing. Today's consultation, or this consultation, was done by ACAN, so it would be more appropriate for them to handle it. But we do welcome submissions, and it would facilitate understanding. So that's the scenario. I'd just like to elaborate on this point. It's very unfortunate because social workers have an important role in treatment and rehabilitation. They have their union that represents them. They have different social workers have different ambits. There are also other bodies outside of the union. We need to confirm that they are a professional body because they have professional qualifications. And the second unfortunate incident is that with the bodies we invited, we have left out social workers. We do have a similar topic where they have been invited, but having the different bodies together where they have different perspectives, it would be better if they could be present. But since we're already at this point, at this stage, I hope we can have a more comprehensive look at the issue. Yes, we'll take note of that. The social welfare panel, they meet with frontline workers. Why didn't we hold the consultation? It's because we were aware that the social welfare panel was doing this work, and we didn't want to duplicate their efforts. So I'm also aware that ACAN and Security Bureau had also participated. Now this social worker group, we have a group of 20 bodies, including we have Drug Rehabilitation Society, and so the professional bodies, we had consulted you. If we had elicited your views, and the Secretary would invite them. But what we got so far is feedback from concern groups. and we had already decided not to invite concerned groups. Okay, but we welcome your clarification anyway. So let's welcome the deputations. We have Public Doctors Association, College of Psychiatrists, Hong Kong Public Doctors Association, the Bar Association. They have taken time out to meet with the security panel, and we've invited your attendance, and we'd like to hear the professional body's views on drug treatment rehabilitation services. So aside from legislators, we have the Action Committee Against Narcotics, and we have also the government officials. So the arrangement is to give the four bodies time to elaborate their views on drug treatment and rehabilitation. So each body will be given 5 minutes. After that, our legislators might have questions for you, and they might want to elaborate on your views. And then on the government side, and ACAN will also see what feedback they might have. So we'd like to hear the professional body's views, and then legislators would also express their own perspective. So that's the purpose of our meeting today. So perhaps I need to mention your views expressed in the council today. You don't enjoy the Legislative Council privileges, so you will be responsible for your own views, and I'd like you to bear that in mind. So we also have interpretation headsets. In the channel 0 is the floor, channel 1 is Cantonese, channel 2 English, and you can take advantage of this service. So let's invite the bodies. The first body is Hong Kong Public Doctors Association. We have Dr. Chan, the Vice President. We also have in attendance from Hong Kong Public Doctors Association, Dr. Mak Siu Keng, Council Member. Thank you, Chairman. The Hong Kong Public Doctors Association will present our views. Dr. Mack has something to clarify. Is it 5 or 15 minutes? 5 minutes. We already have a written submission, and Dr. Mack will submit our views. I am Dr. Mak Siu Keng. I'm a urologist, and I've been working in Seung Sui, North District, and I would like to share with you some of our experience in helping rehabilitation, drug rehabilitators. I have an MRI picture. We have an early drug taker, and on the left-hand side is a chronic user, and you can see that we have the kidney, the MRI image, and we see that it would balloon. It's a hydrophenosis, and on TV you see that because of this there is inflammation, and they need renal dialysis. and you see that they need to use a urine bag to help them pass water. I've seen these drug users in intensive unit because they have emergency situations. It's a nightmare for these drug users. It's also a nightmare for us because when we have to deal with emergency cases, it takes a lot of resources. And I've also seen a lot of rehabilitated people with a lot of side effects. They need renal dialysis, so it's a heavy burden on our resources. Based on this situation, we have a basic procedure. If we can have early intervention, then the consequences are much better and it will alleviate pressure on our system. So as a urologist, if we can screen patients, we can get very good outcomes, including the prostate cancer. We can identify that at an early stage, and this has also been confirmed by the U.S. urology specialists. That is, we can save lives earlier with early intervention. So I'd also like to use this opportunity and this example to explain to you that drug takers, they are subject to a lot of effects, and as doctors, if we can have early intervention, we can help them, we can reduce their long-term side effects from drug taking. You are aware that kidney inflammation can lead to hardening and so on. We also have MRI pictures. You can see on the left is an early stage, and on the right-hand side it's a late stage. And you see it's it looks like it's been blown up. So it's very similar to an emergency inflammation case. We need to conduct a lot of surgery to help these patients. So in our past experience, we find that the drug taking, aside from being a social problem, it's also a personal healthcare issue. It can hurt the body, and we also find that in the last few years, in schools, in the community, drug taking can be spread. We call it social cancer with the infectious capability. It also has a characteristic that it can be spread amongst peer groups. So long-term drug users are like cancer patients. So under the same circumstances, when we deal with respiratory disease, before it is spread throughout the body, if we can screen early, we can intervene early, we can manage it, it can prevent the spreading of the disease.
Also in the medical field, we can have numerous examples where early intervention and screening can help lessen the disease. For example, glaucoma, which result in blindness, and also limbs gangrene from diabetes mellitus, and also stroke from arteriosclerosis. If we can screen ocular pressure, blood sugar level, and cholesterol level, which are all very simple and effective means to increase the awareness of the patient, and we can save vision, save limbs, and even lives of these simple by these simple screening tests. In all these years in the North District, we have conducted many initiatives in order to help screen these youngsters. We have outreach clinics in Kwai Chung, Chin Wan, Tai Po, and the North District, and we have seen that 230 young persons have attended, and we could see about 30% of them admitted drug abuse. In other words, 70% drug abusers do not admit that they have a problem, and they do not understand that drug abuse is affecting them. Sorry, time is up. We can only allow you to speak up to this moment. Thank you very much. Next, the Hong Kong College of Psychiatrists. Dr. Chang Wai Him. You are from the Kwai Chung Hospital, the associate consultant. We also have from the same college, Dr. Ronnie Pao, also an associate consultant at the Kwai Chung Hospital. Which of you would be speaking, please? Dr. Chung, yes. Chairman, members, good afternoon. I am Chen Wai Him. I represent the Hong Kong College of Psychiatrists at this meeting to talk about our views on the rescue drug testing scheme. I am at the Kwai Chung Hospital Drug Abuse Assessment Center. Every day we face patients who have psychiatric disorders resulting from drug abuse. At the Hong Kong College of Psychiatrists, we held 2 discussions on the RDT. We talked about our experience facing these patients in the front line, and also in our board of directors, we have psychiatrists from different backgrounds, and they commented on the issue as well. We have several views on the RDT. First of all, we welcome the administration's initiative in order to tackle the hiddenness of youth drug abuse, and the administration is now proposing to do something. We welcome that initiative. However, we have read the report or the consultation paper and the relevant proposal. We have some reservations about the present proposal. I think our colleagues had concerns about human rights issues, and also if mandatory drug testing and also rehabilitation programs are mandated. We don't know whether there is more concrete information for us to support that kind of approach. We have dug up some information, but we were not very successful. We could not find concrete surveys or data to support what the administration is proposing, so we doubt the effectiveness of the proposed RDT and whether it can really help us discover the so-called hidden drug abuses. I believe most people now stay at home to abuse substances. They stay at a private place. So this scheme under consultation may not help us target this big group of people who are really hidden. When we looked at information about other countries, we know that in the UK there is a slightly different scheme, which nevertheless also seeks to identify abuses at an early stage. It is called the Arrest Referral Service. The spirit of the service is also to identify drug abusers at an early stage, so information can be given to them and hopefully they can be lobbied to accept referral and then some rehabilitation treatment. Compared to this RDT being proposed, the ARS is different in that the service is only triggered when a person is arrested for breaking the law. The person may be taken to a police station, and also the police should have seen signs of drug or alcohol problems. Maybe that person would admit that he abuses drugs. Then information would be given to the drug abuser, and they will see whether the person would agree to being referred. so assessment can be done. And actually, at the police station, there would be social workers who would help with the assessment and then for onward referral. And the referral service would be triggered only when the person is arrested for breaking the law. So it is different from what is being proposed in Hong Kong at the moment. Okay. So I think we can think about whether we should follow the UK example. And of course, it can be adapted for the Hong Kong environment. So we can also try it out for some time before we take it further. And of course, if it's found to be ineffective, then we can think of other ways to do the same thing. Thank you, Dr. Zhang. Next, Hong Kong Bar Association. We have Mr. Michael Blanchflower, SC, and also Mr. Lo Pui Yin. Who would be speaking, please? Mr. Lo. Thank you very much, Mr. Chairman. And good afternoon, members. I represent the Bar Association together with Mr. Michael Blanchflower. I would be speaking now, but Mr. Blanchflower and myself would be happy to take questions. The Hong Kong Bar Association put in a submission to the ACAN on the consultation paper. We object to the proposed RDT scheme. We oppose the scheme for two reasons. One, we expect that after the RDT scheme is introduced, there will be expansion of police powers and also other law enforcement powers, and such will seriously interfere with the fundamental rights for Hong Kong residents as provided for by the Basic Law. Secondly, the proposed RDT may be for a good purpose, but the consultation paper cannot show why it is necessary to introduce the scheme. Now, at this early stage, well, actually, this can date back to late 2008. Well, there was this task force on youth drug abuse, and it issued the report, and the Hong Kong Bar Association also issued a position paper on the 8th of January 2009, and we have included that as an annex to today's submission. When we wrote the position paper, we looked at cases in many different places, and we stated to the administration that if we should have mandatory drug testing on certain people, there should be very stringent rules, and it should only be for very limited purposes. And the groups of persons to be mandated for drug testing should be narrowly defined. And we think that the observations on that position paper remain valid. And it seems now this RDT will target all people, and I think there may be a problem. And coming back to the two main grounds for opposition, I'd like to talk more. First, the extraordinary police powers, which may come into play if there is the RDT. Starting from para 10.3 of the position paper, you can see that we have looked at the consultation paper, which says that the law enforcement officers could identify people who are reasonably suspected to have taken drugs. Now, we think that those conditions are not going to be helpful for protecting Hong Kong residents. And in fact, some bodily conditions may be related to drug abuse or to the use of alcohol or other medication. So this may be a problem, and we are concerned that there could be the risk of arbitrary use of power. And in para 14, we cited an example that in a concert, there could be a person who would be seen to have powder under his nose. Now, does it mean that he has a problem? And also, does it mean that the people around him should also be reasonably suspected to have abused drugs? So everybody should be taken back for mandatory drug testing. This is worrying. In para 16, we have said that the SCMP has reported that the police in Hong Kong can ask people to show their ID cards, and compared to London and New York, I think there is a certain degree of abuse. So we have these worries. As for the second main ground for opposition, we have read the report, and we believe that there is not a very serious arguing over the severity of the problem in order to establish the necessity of the scheme. Just now, the Hong Kong College of Psychiatrists has also said that if this is a hidden case of drug abuse, then it will be also difficult for law enforcers to be able to identify these people in a public place. And this is a problem that we have identified. And also, I like to use another 20 seconds to cover paras 22 and 23. And that is, if a person has been tested a third time and is established to have taken drugs, then he will be prosecuted. There will be a new offense created. And the basis for prosecution would be mandatory drug testing procedures. We have great reservations about this. We believe this will be a big damage to the person's integrity and privacy.
Next, we have Mr. Jie Hongheng from Hong Kong Medical Association. The Drug Treatment Rehabilitation Service, on this subject, we have already submitted our submission to the Security Panel and the Narcotics Division. We do not support RDT scheme. We object. Why? It's because we think the scheme does not help drug takers rehabilitate. It's called RDT, but it doesn't do that. It only drives it further underground. From the doctor's perspective, these drug takers, people with a habit, like people with alcoholic dependency, gambling, obsession, it's the same. They're patients. You are the ones who are labeling them as criminals. You legislate them as criminals. From the doctor's perspective, they are patients. We're not trying to punish them. We're trying to help them. For these people with a habit, there isn't any specific treatment. We have to rely on motivational counseling. Motivation counseling is not a silver bullet. We don't have such a silver bullet. We rely on motivational counseling. If you detain them, they will stop drug taking during the detention period, but once you let them go, they will resume. So it doesn't help them rehabilitate. Just now we heard doctor representatives saying that with early screening, we can identify what diseases they have. From the medical perspective, when you conduct diagnosis, it's very normal. You can check urine samples and so on. Why do we object to urine samples? So there is a basic difference between regular patients and drug takers. When you take urine samples of other patients, before their results are out, we don't know what diseases they have. But with the RDT scheme, before you take a sample, the drug taker knows whether they are drug takers. They don't need the urine sample. They know whether they are drug takers. So taking the urine sample just allows other people to know whether they are drug takers. So please do not be misled by the urine sample. This is not a regular urine sample from other patients. It's a basic difference. Please do not be misled. Some people also say that school drug testing is very successful, so we should promote it even further. But that's two separate issues. School testing is voluntary, totally voluntary. It's not mandatory. They don't need reasonable suspicion. So please do not mix the two. Don't take school testing success and promote it further in the community. You've heard a lot about successful rehabilitation. What do they usually say? They will say they find that they cannot continue with their old ways for different reasons. They cannot continue. They need to shake the habit. So that means successful rehabilitation needs a condition. They need to kick the habit. They have this intention to kick the habit. As doctors, we don't have informed consent. We cannot treat them against their will. They are aware they have a condition. They know whether they are taking. They don't need a urine sample to know that they're taking drugs. They want to rehabilitate, and we can help them. But if they don't have that intention, they don't want treatment. It's like a patient, they need a blood transfusion. We can, but they don't want a blood transfusion, so we can't help them. So as a doctor, there are some circumstances where we cannot help these patients unless the patient is willing to accept treatment. So in drug rehabilitation, on the issue of drugs, I don't think just one scheme can help. And I had had a discussion with the previous Secretary for Justice. If you want a success in anti-drugs, you need the whole community. Schools, teachers, parents, the legislators, everybody has to work together. And that would only give you a glimmer of hope in tackling the drug problem. Otherwise, just relying on the single scheme is meaningless. It doesn't help at all. Thank you very much. Thank you, Dr. Chen. We've heard 4 deputations expressing their views on the RDT scheme. So we now have 郭偉強、Lena Wong、黃毓民、郭榮鏗、梁家傑、葛珮帆、陳志全 and Sid Ho with questions. Anybody else? Mr. Yik Jiming. Anybody else? Chen Ginbo. Okay. Before you start questioning, do we have any initial response from the government officials? We have in attendance Professor Daniel Sheck, Chairman of Action Committee Against Narcotics. We have Ben Chung, Dr. Dek Ji Yun, and we also have Commissioner for Narcotics, Mrs. Erica Hui, and Ms. Mandy Wong. So, Professor Sheck, I'll respond briefly. First of all, under Hong Kong laws, drug taking is illegal. We need to clarify that first. And second, I have to thank the different bodies for expressing their views. I'd also like to add that recently a group of doctors have set up a front, a concern group. They feel that RDT should be implemented to help drug takers. I'd like to respond to the concern about human rights. First of all, individual rights are not absolute. It does not necessarily have to be balanced with the public security and in the Bar Association submission. We have already made it clear. For example, in the road traffic ordinance, it allows the police under reasonable suspicions to conduct drug testing on certain people. At the operational level, our consultation paper states clearly that the threshold is very high. We mentioned the different procedures to limit police powers. Reasonable suspicion is a legal term, so in it's expounded on in the different parts of the Hong Kong laws. In the consultation paper, we also mention the drug age is increasing, and it's not an individual issue. We have had Castle Peak Hospital to do some analysis. We found that violent behavior associated with drug taking, and that's even more serious than driving under the influence of drugs. Since we have deputations here, you can raise questions directly at them, or you could have them conduct more sharing. Let's limit Q&A to 4 minutes. We have 12 legislators. So let's keep it at 4 minutes. And the government officials can also respond. Kok Wai Kang. Well, we have a lot of professional bodies here today. Thank you. So aside from providing your own specific professional views, some deputations might have touched upon issues beyond their professional area, but that doesn't matter. We all agree that we have to work together. No single body can complete or can conduct the job. So we appreciate everybody's efforts. It seems like today's controversy is whether the issue is serious, whether drug taking is serious in Hong Kong. We have 10,000 drug takers. I have asked Professor Shek. We have hidden drug takers, drug users. And the conservative estimate is that 3 or 4 times, the actual figures are 3 or 4 times the official figures. So that makes it 30,000, 40,000. In the past, we had opiate drug users. It was a physical addiction. But now psychotropic drugs, it damages the brain. So even with rehabilitation, they are not exactly the same as before they took drugs. So I'd also want to emphasize that you will feel that during drug testing, it might affect human rights, or it might change the police rights. Well, this is a social cost. This is a cost we're already paying. You're providing treatment, welfare. All the non-drug takers are already paying, are already footing this bill. For non-drug takers, does it mean that we cannot take on this extra burden? Let's say I take a pill for the flu, but it won't have any effect. But we need your agreement. The doctor said just now, the effect on the body a lot of it is irreparable. We need to bear that in mind. So I want to ask the doctors, on the issue of costs, we are aware that, let's say if you want to treat cancer, it would affect the liver, it would affect your internal organs. So to achieve a certain purpose, there are certain costs. So why can't we apply this in the drug testing scheme? So my question for the doctors, Dr. Chair, do you think, well, since you feel that everybody has a responsibility and drug testing is part of the solution, could we add that in our current services as I'd also like to ask the Bar Association, Mr. Law, regarding police powers. You say with the amendment, you're saying that drug taking is legal. I thought you were objecting because of that. It seems that you're concerned about police rights, human rights. Professor Sheck mentioned that driving under the influence, or we already have a drug testing mechanism. Why isn't that a problem? Why should it be a problem on drug takers? One big one. Miss Helena Wong. I have two questions regarding the compulsory drug testing. Well, we heard the professional bodies mention the first challenge, and the government should respond. That is it effective? Your paper says the RDT scheme, it's quite misleading. The professionals have said that drug testing, mandatory drug testing, is it equivalent to finding these hidden drug users and compelling them to do to take drug treatment? Well, it's not proven. Just now, Dr. Zhang from Kwai Chung Hospital had questioned the efficacy. Can you really find these hidden drug takers? If you try to hunt them down, you're going to drive them further underground. Just now, Dr. Zhe Hongheng mentioned that if they have no intention to shake the habit, is it possible to treat them? He talked about motivational counseling. So a person, if he's not willing to shake the habit, and after he's released, he's going to go back to drugs. So your premise, can you convince us that the mandatory drug testing is necessary? Second question.
Whether we are seeing the disadvantage before we see the advantage, the Hong Kong Bar Association has said that they object to the program because they are worried that there would be expanded police powers and infringement on human rights. I have been on the IPCC for a few years, and I can observe that there are police officers all over the place, and they have very big powers already. And compared to other countries and cities, we have a high police ratio, and they can always stop and search. And at the IPCC, we always ask whether there is abuse of police power, in that they always stop and search people. How many criminals have they discovered? And also, we would ask whether they would discriminate against people who are in rags, and also the young and also the ethnic minorities. We asked them for stop and search figures in categories, but they have refused to do so all these years. Now that you have the RDT, you give more powers to the police in that if they query your behavior, and they can already arrest you, etc. So we were asking whether there would be abuse, whether they target the lower stratum, the ethnic minorities, etc. But even the IPCC cannot get those figures. So you have to answer the question whether there will be abuse of police power. Well, I hope you will ask questions focusing on the deputation's views, but it's up to members. Did anyone raise their hand? Professor Sheck? Just now, Ms. Helena Wong talked about police powers, and I have certain figures. From 2008 to 2012, on the average, the police stopped and searched 2.17 million people, and through these actions, they were able to crack 22,500 cases. And in the past 5 years, they were able to detect crimes in a quarter of those stop and search operations. So it amounts to 0.01%. And unlike what some people said, that there is huge abuse and that such actions are not effective. But as to whether we should make it mandatory, I will ask Dr. Zheng to answer that. Mr. Wang Yukman, on the 5th of November, at the panel here, I said very clearly that I strongly object to RDT. Its operation is gross infringement on human rights, and it goes against the principle of common law in that no one should be regarded as guilty before he is proven to be so. And Professor Shek, whatever you say, whatever figures you quote, you have to look at the basic operation. There should be presumption of innocence that is protected by the basic law and the ICCPR. And also, criminals under the common law should be able to keep silent, and before a conviction is there, you contravene Basic Law Article 28 because you mandate drug testing on them. You talk about strong circumstantial factors and also reasonable suspicion. Well, nobody can handle these except the court. At the last meeting, Professor Shek argued with the proposals of drug driving and drink driving. I like to tell you that, in fact, these go against the presumption of innocence and also certain human rights. It is just that they have not been challenged. It does not mean that they are right. If in case somebody takes these cases to court for a judicial review, we may think that the court may come up with a different view. Therefore, you cannot quote drug driving and drink driving and say that they are not challenged. But this is a very general statement that you are using. But everything should be clear in the law. Also, I think a more constructive way of doing it is for the association to respond to the constitutionality of the RDT. Don't mix that up with drug driving and drink driving. This is a highly controversial topic. You cannot make general statements when you answer questions. I am really angered by your way of answering questions. You have heard Dr. Che Hong Hing? Frankly speaking, whether it be the Bar Association or the Medical Association or College of Psychiatrists, they all object to the RDT. So you are clear, you know their views. Of course, there are doctors who are for the scheme. But the Medical Association is opposing because it doubts whether the police have the power and the ability to identify the symptoms of drug abusers. I doubt your ability in making a judgment. And I doubt that it can amount to an abuse of power. And you cannot answer that question with figures. That is such an important point. You have to train police officers to give them the ability to judge whether a person is exhibiting symptoms of drug abuse. And also, the social workers also object. They are outside. They are not invited in today. And then I also have to point out that your so-called circumstantial evidence, on the one hand, you say there is a drop in the number of drug abusers, but on the other hand, you say they are hidden. Well, even if you have the RDT, there will still be people who are hidden. You cannot ensure that with the RDT, there will no longer be any hidden drug abusers. Plus, under the RDT, you are not going to prosecute the first-timers, but you are sending out a wrong message, making people think that taking drugs for the first time is not an offense. But now you say No and never to drugs. That is your slogan, but you are going against it. Next member, I'd like to thank the Bar Association for coming and for letting us know why the RDT is problematic in terms of constitutional rights and also police power. I think the position paper of the Bar Association is already extremely clear because the proposed mechanism just cannot meet constitutional requirements. I hope the Bar Association can further elaborate on that point. And also in para 8 and also para 9 of this submission, the Bar Association quotes Canadian cases. These have to do with human rights arguments and why mandatory drug testing is definitely unconstitutional. I'd like to ask whether, apart from Canada, you have cases from other jurisdictions, so we can also take note of those examples. Can the Bar Association please answer those two questions? Yes. First, Mr. Dennis Kwok, you asked about other jurisdictions. I can ask members to refer to the annex. And this is our position paper in the last consultation exercise. Please refer to pages 3 to 6. No, sorry, page 8 actually, where we have listed the United States, Canada, the UK, and also the European Court of Human Rights. And so we arrived at the conclusion in January 2009. So we objected to mandatory drug testing. That's to answer the second question. The first question, is it that the present proposal goes against the basic law? First of all, we need to solve a problem, and that is the present proposal applies to everybody in the street, seen by a police officer regardless of age. At the beginning, it seems the RDT set out to tackle youth drug abuse, but the present proposal applies to everybody. As we said, mandatory drug testing should be applied only to narrowly defined groups of people with very limited purposes, and therefore the RDT as proposed here goes against that principle. So I believe we are also answering the question by Mr. Kwok Wai Keung, who asked us to make a comparison with drug driving and drink driving. I'd like to see whether Mr. Blanchflower would like to add. Mr. Blanchflower, would you like to supplement?
We've touched upon it in paragraph 22.7. Our submission is that it is wrong to make a comparison or the analogy with drug testing for drivers under the Road Traffic Act. It's a wrong analogy. When a person is driving under the influence of drink or drugs, he is an immediate threat to people, the public, to damage. And it's the statistics worldwide bear that out. So it is a wrong analogy to draw.
Oh.
Thank you. Mr. Alan Leong, followed by Ms. Elizabeth Quat. Thank you, Chairman. The Civic Party's position is that youth drug abuse is a public hygiene problem. It is a problem about persons instead of a law enforcement problem. If you only look at it from the angle of law enforcement to the extent of creating a new offense, we believe you are going away from what society needs and also what the nature of the problem is. The Civic Party thinks that the administration should come up with a comprehensive argument and plan to help drug abusers cease the taking of drugs. That is important. But if you look at the present paper, there is very little coverage on this area. We believe you have looked at the issue from a wrong perspective in that you only view it as a law enforcement issue. Chairman, I'd like to take the opportunity to ask the Bar Association a question. Just now, I think they touched upon it already, and that is whether this is proportionate. The proportionality and necessity of the RDT. Can I please ask the Bar Association to spend a little more time on why in your submission in Para 9, you talk about the proportionality test and you say that the proposal from the administration does not prove that there is necessity so that it can meet the proportionality test. Bar Association, please. In this respect, in Para 9, we have detailed the principle now adopted by our courts. And we have quoted from the latest judgment in December. And at the same time, we would like to propose another test or principle that also applies.
It has to be confirmed. Chairman, my time is limited. I would like to focus on the issue of driving under the influence of drugs and alcohol. Mr. Blancheflower said that the analogy cannot be drawn. So is it because driving under the influence of drugs and alcohol, does that confirm with the proportionality test because it will affect a third party, it would affect property, it's an immediate threat to life and property. So it's in compliance with the proportionality test.
Look at drink driving. Whenever countries enacting laws, it's backed up with very strong, compelling evidence of the statistics of, say, the wreckage of drunk drivers that bring upon the public. So there's a very clear justification for such laws.
Okay.
Elizabeth Quat and then Mr. Tan Ji-Xun. Youth drug takers, aside from affecting their health and mental state, it also has a profound impact on the family, on the community. It's a public health issue. Just now we heard a debate about some issues, whether it's a mandatory drug testing, is that constitutional, whether it's effective in helping the youth. So I do have questions for the professional bodies. I'd like to ask the Hong Kong Public Doctors Association. You said it has a profound impact on health. So this RDT scheme, can it help these young drug takers? Do you think it's useful? I'd also like to allow some time for Dr. Zheng Kim-man. I'd like him to respond first. Dr. Mak first. In Northern District, in Siang Sui Hospital, we had an outreach group to serve where all the social workers could refer the cases to us. We could do health checks and drug rehabilitation. In the first year, we had 500 bookings. These were all the social workers dragged these people for treatment, and we found that they could only have 360 revisits, and then there were only 84 who would take up our offer. So it shows that their motivation is very low. So you see that the social worker, they want to help where the difficulty lies. The drug takers don't feel that there's a problem. So after 1 year, when they completed the short-term rehabilitation, some 70% motivation was improved. We don't have to wait for their motivation. In the pictures that we showed them, that motivated them, and 2 weeks later, 60% could maintain a high motivation to continue other social welfare programs. Since we have a cooperation with the social workers, 3 months later, we surveyed these people again and found that their motivation was maintained. So 28% were drug-free for 3 months, and 80% were actually to reduce the number of drug-taking frequency. So I think that can prove that if we have drug testing, if we have a suitable rehabilitation program, we can help damage to the body. It can also alleviate burden to society. So Dr. Chan and I, members of Hong Kong Public Doctors Association, we were nominated to express views in LegCo. We are frontline doctors. Every day we face life and death issues. We see a lot of chronic disease patients that pass away because they can't be helped. The human rights issue, this is beyond our profession, but as responsible doctors, we want to help the drug takers, and we suggest early intervention to identify these people. And we propose a systematic drug rehabilitation program. Dr. Zhang, I'd like to respond to motivation counseling. This is the most effective and conventional treatment. The efficacy is only about 40% in world-class institutions. William Miller did some studies that out of 100 drug takers, at most 40% were able to respond to motivational counseling. So some people, no matter how much counseling or motivation you provide, because of time constraints, we have to move on. It's 很激进. So finally, the security panel could talk about mandatory drug testing. On 5th of November, I had mentioned this, but you said that the social welfare panel was dealing with this, and therefore we now have this discussion. But it's very unfortunate that the professional social workers are not able to attend. Is it because they are not the relevant professionals? So regarding this topic, we object. We have to just look at whether it's effective, whether there's abuse of police powers. Well, I need to thank the deputations, especially Dr. Zhang from the Hong Kong Medical Association, because you stood out. You objected to this program. You said that it would only drive the drug takers underground. Professor Shek questioned your credibility. He said that they only had a few members. So if we might have to take a vote to see who's. And he also questioned your knowledge. He said that drug testing for driving under the influence. So, Dr. Che, you can respond. I think Professor Sheck's the strongest argument is that there's already testing for driving under the influence. It's been effective, and you don't need to be worried. This is nothing new. So a lot of our legislators have asked the Bar Association on the legal perspective, driving under influence and the mandatory drug testing, what's the difference? I heard the immediate danger. We had discussed this as well. The drug takers, they can turn violent under the influence. That's an immediate danger as well. So I'd like to hear a further elaboration on what's the difference between DUI and the mandatory drug testing. Dr. Che? Let me respond to the question. Driving under influence, it affects driving performance, and the police, you've authorized the police when the police see that the driving performance is inhibited. This is not a clinical test. It's a driving attitude or driving performance. It's not a doctor's clinical diagnosis. We're just questioning whether the police can make a clinical diagnosis of whether a person is a drug taker. I'd also like to respond to a previous question. So, should society accept this cost? So, my response is treatment. Could we accept side effects of treatment? If we accept the side effect, then we have to see what is the efficacy of the treatment. Does it work? If there's no effect, then we don't even need to talk about side effects. That's it. Ms. Sidho, I agree with Dr. Chair. Drug abuse is it's inflicting self-damage. It's like cirrhosis from having too much hairy crab. I've met with drug-taking students. They just want to evade, avoid reality. It's just reality is just too unfriendly for them. So if you can't help them regulate their lives, then you can only rely on the law and detain them in somewhere else. So mainstream society doesn't have to deal with these people. But the side effect is very severe. It's not only not effective, there's a very severe side effect. I would like to ask the Bar Association, in your paper you say you call for cross-border cooperation. So extra-jurisdictional behavior would also be affected. So when they take drugs across the border, that would also be a crime. So the Bar Association paper says that this would lead to even further problems, because in reality, a lot of young people, they cross the border to take drugs. So can we enforce the law across the border? What problems will arise from that? Mr. Law? Yes, in our consultation paper regarding cross-border drug taking, we had spent less effort on this issue, but in our previous report we mentioned there was more material in the previous paper, and you can refer to that. You can refer to paragraphs 11 to 13 in the annex. So a person's behavior outside of Hong Kong, if that is a indictable offense in then that would be extra jurisdictional. Usually, this is an extraordinary example. So when you legislate along these lines, you need to confirm these extraordinary cases. And when you prosecute, if there are quite a few problems arising, if the person has already been convicted overseas or detained overseas, should they be prosecuted? And there's also a problem with gathering evidence. Let's say you might need cooperation on gathering of evidence across the border. So all this lead to further problems. So even though we didn't spend a lot of thought on this issue, but we are concerned about the different arising problems. Unfortunately, the consultation paper in 2013 didn't mention this. Well, Chair, and this is important because the law in Shenzhen is very different from us. So if we're talking about extra jurisdictional arrangements, we're not ready, and China is not ready as well. Drug taking, it's not an individual problem, it's a societal problem. Mr. Kok Wai Kang mentioned that society is paying a cost to help these people. So if we can detect them earlier and provide support, that's better than late intervention. So what do we mean by appropriate support? Well, it doesn't mean that we should identify them and place them in a rehabilitation center. So the Liberal Party has done a small survey, and we asked the public whether if a law enforcement officer discovers drugs in the vicinity, can they conduct can they get further investigation? 79% agreed. So this is a very controversial issue. So we asked the public, are you worried that drug testing will infringe on privacy because of the increased police powers? The response was 50-50. But I think the government will conduct a more in-depth survey and come up with more results. Now, from my own personal experience helping rehabilitators, and on the last occasion you heard from the frontline workers that the majority of them support drug testing because we understand that these young people are affected by peer pressure. So if they are identified at an early stage, it is helpful to them.
So I support it. In point 5, that is where the advantage lies. I think we should consider the scheme. Thank you. Next, Mr. Chen Kin Paul, and then another member. I respect Dr. Che Hong Heng saying that drug abusers are just like people smoking or taking alcohol. I think he is looking at things from a medical angle. But as a legislator, if we look at the impact brought about by drug abusers in Hong Kong, then I would think differently. Last time, the ACAN stated very clearly that they might chop up people in their families. They could throw people from a height. They could push people down onto a railway track. And it would not be less harmful than people driving under the influence of alcohol. I don't know why this message is not getting through. It is not just a personal kind of behavior. And if you remember, if there are more people taking drugs, as you know, there will be a lot of impact on their own health as well, the liver, the bladder, etc. And when the population is aging and these people are fighting for medical resources with the aging population, then those people are innocent. They're just getting old. But then this group of people is not controlling their own behavior, so they are making use of medical resources which should be used on people who really need them. I have seen drug abusers from very young, and in fact, they really do a lot of harm to their own lives and to other people. They can do anything just to get money to take drugs. So please do not just look at the issue from your own profession. You should have a comprehensive view on the impact on society. Just now somebody said, allow them to get motivated. That would be most effective. But let me ask ACAN, in your experience, how many people took the initiative to say they want to have cessation? But I believe if somebody forces them to kick the habit, I think it would be more effective. Say if it's a child, he can go on for 10 years if it is not discovered. But if the parents intervene at an early stage, I'm sure will help that child. So can you please confirm whether motivation therapy is the best, or should we apply some force? Dr. Zheng, if we allow drug abusers to stay and wait and until they are ready, of course, yes, it will be good. But then the effectiveness is only at 30 to 40%. If the ACAN only targets the willing, then what about the rest? I like to look at the submission from the Hong Kong College of Psychiatrists. They talk about the ARS in the UK, the Arrest Referral Service. It is very effective. Many people ask whether the RDT can really help to rehabilitate drug abusers. But if we apply the same methodology, if the drug abuser is supervised by police officers to keep their urine free of drugs and also to receive rehabilitation services, then actually we can save over $4 billion a year. And we will help them to stay healthy, to hold down a job, and also will help the families. Now, why is it that today there are a few deputations who think there is not enough evidence to support the program? Now, if we want to follow the UK example, first of all, we have to wait for these people to break the law. Just now, Dr. Jie said it should not be mandatory, but we would only achieve 30% effectiveness. However, there is a medical journal saying that if somebody takes drugs and he breaks the law, then he will be mandated to kick the habit, and then with supervision and rehabilitation, the effectiveness is very high. Of course, we can wait for those who are willing to come to us. But if we want to help these people who have a lot of health risk, then according to the UK example, we can also have suitable supervision. We just want to take another step. We just don't want to have to prosecute these people, because then they will have a criminal record. Mr. Chung Kwok Pan and then Mr. Leung Chi Chang. Well, I think what one doctor said is very reasonable. Now, there is a whole plethora of different drugs. Now, we have ketamine and other kinds of drugs. And also, the drug abusing population is getting younger as well. If you expect young people to suddenly come to their senses and say, I don't want to take drugs anymore, well, I don't think there is any opportunity of that happening. Just now, Dr. Chair has been too theoretical. If we can have early intervention, very often we can also help the families. Very often, young people are influenced by their peers, and so they are addicted. But if the family is alerted, then there will be family pressure, and the young people will be able to leave the addiction early. So let us try to help as many as possible. Let us not just talk about the Constitution and human rights and forget about these young people. It is a social problem. It is not just a legal issue. There is a lot of social cost involved. Just now, the Hong Kong Public Doctors Association said that they are at the front line. They face the problem every day. If you want the young people to have the initiative, maybe their kidneys are beyond repair. So let us say we want to save as many as possible. So I think we should give this a try. We should not just look at the issue from a legal or medical perspective. It is a social problem. Yes, the deputations have asked questions of the ACAN. I think Professor Sheck, you should go back and try to answer all the questions. Okay, thank you for that comment. Mr. Leung Chi Chang and then Dr. Fernando Zhang. Thank you, Chairman. Indeed, drug abuse is not just a problem for that person. Well, that person may find it enjoyable. Or else, why is he doing it? If he should throw up and vomit from it, then he would not continue. But he, first of all, enjoys it, so it becomes a habit. From what I understand, well, I'm a Tin Shui Wai district councillor. I have seen a case of drug abuse. He came to me, but I could not tell. I don't know whether in future trained law enforcers can tell the difference. And in the end, he was beating up his wife, who was injured, and he was taken to, both of them went to the hospital, and then the wife came to me, so I knew. And you may think that this is a family problem. And then in another case in Tin Shui Wai last year, somebody was chopped to death, and it was a result of a psychiatric problem from drug abuse. So now the argument is, if the police are given the power, then the police might not be able to tell. Just like me, the police may take a person for testing and then just say, sorry, I made the wrong judgment. So I'd like to ask the ACAN about law enforcement. If, you know, the police can enter entertainment premises, but usually the hidden youth abusers will not be in a public place. Why don't we first of all ask social workers to intervene and then for them to refer the abusers to the police? And also I'd like to ask the College of Psychiatrists, is it that if there is taking of cocaine and ketamine, would that lead to psychiatric problems? The College of Psychiatrists first. Dr. Zhang. Thank you, Chairman. The psychotropic drugs attack your brain, and it can trigger symptoms of psychiatric diseases. Under the influence of drugs, people may exhibit those symptoms. And the first question, Professor Sheck. The social workers can cooperate with the police. We have an open mind. I can say that we have had the superintendent's discretion scheme for many years, and in that the police also cooperate closely with social workers. Leung Chi Chang, if there is a law, then only the police officers can enforce the law. And how can you tell a person is a drug abuser? You have to look at his behavior, and you look for signs. And then if the power rests with the police, then the police can take a person for testing. Even a legislator can be taken for testing. I understand that society is worried about possible abuse of police power. Can we allow social workers to do this? I have 2 points to make. Under the driving under the influence of alcohol scheme, law enforcers have to undergo a very stringent training program. They have to take an international exam. And I can tell you that international medical literature has said that with proper training, police officers can be right in their judgment in 90% of the cases. the member. I need to, Dr. Fernando Zhang, I need to declare that Professor Shek is my colleague. But still, we have our own viewpoints. I have grave reservations and also worries towards the RDT. I understand that drug abuse is an offense. But sometimes we also jaywalk. We also break the law. It's about your attitude towards drug abuse. As a social worker, we would view this with compassion. We would look at this to regard it as a public health problem, and also we would look at the family and also what the young person may be facing. Well, you may question whether what we do is effective. This is what Dr. Zhang is asking as well. But should we just go for this broad brush RDT, which will result in a change in the law so that the entire process becomes irreversible? I have grave reservations about this. If we only rely on rehabilitation services and social services to help drug abusers, well, that may not be effective. And perhaps some of these people really need to be compelled to accept treatment, and who will kick the habit only with a lot of support. I think that is sometimes the case. But now you are talking about a legal amendment, and the enforcement power is given to the police. We are not saying that the police are not to be trusted or that they are not professional. Of course, we have to trust the police, but we cannot rule out the opportunity for the police to make use of the mechanism to get even more power. Since this is irreversible, we cannot possibly support it. But if there are arrangements, well, actually there are these arrangements now. The police are also enforcing the law now. And if it is found that somebody has broken the law, then you can take him for drug testing. As the College of Psychiatrists has said that the UK system is comparatively more effective.
So I don't see why you can't strengthen those areas, and we know that there are insufficient downstream services. So what happens after the drug testing? There's no follow-up, and there's even long queues. So it's controversial even in the social welfare circle. A lot of hospital service providers are in agreement. They want this drug testing, but the other social workers are against. So we have to be very careful in dealing with this topic because we're talking about amending the law. So this is our view. And I would also like to thank the deputations for attending. But it's very unfortunate that the social workers are not able to attend. The social welfare panel had convened a meeting on this topic. We just don't want to have two overlapping meetings. Mrs. Han Jixun also mentioned this just now. Okay, my time's up. So I had allowed 4 minutes for Q&A, but now we also have another agenda item regarding follow-up on quarterfinal appeal order in the judicial review case W versus Registrar of Marriages. So I'd like to extend the meeting by half an hour. Can we run to 5 o'clock? And in order to have sufficient time, we have Mr. Leung Kok-hong who wish to speak. So I cannot allow 4 minutes because I can't. There's insufficient time. So I have to reduce the Q&A to 2 minutes. So my own follow-ups are also limited to 2 minutes. We've heard a lot of the experts, the medical experts, the law experts. So from my own personal criminal case experience, this suggestion I think police powers are expanded too much in this proposal, because in frontline cases, a frequent complaint is some grassroots people with a criminal background or drug-taking background. They complain that they are abused by the police. So this is one reason why the public feels aggrieved. And of course, this is experience from many years ago. I feel that the situation has not improved. And Hong Kong, being a free society, if we are to shift the goalposts, we need to be very careful. We have to prevent expansion of police powers. We don't want the majority of people's rights or to be sacrificed because of a minority. So whether it's the reason is to try to save social resources, or whether we want we don't want to restrict our long-held freedoms, so we want to be very careful. So before we have evidence, or before we have concrete evidence, I think we need to be very careful. So I don't want to take this step. Mr. Leung Go-hong. We need to reduce pollution at source. We need to target drug imports. So we have in China a whole village manufacturing drugs. And if we have a tunnel along the border, I think that the police should target that first, rather than drug testing. They should stop drugs coming into Hong Kong. If they don't do a good job there, they should be reprimanded. They shouldn't be punishing the drug taker. That's number one. Second, if there is voluntary drug rehabilitation, if we have people or drug takers still passing blood after 9 months of treatment. So what can you do? You're trying to be a parent, an authority. You are putting the cart before the horse. If you want to save people downstream, then you shouldn't be asking the police for help. You should be working with the drug rehabilitation organizations. Why should you be giving police more powers? They should work with the Mainland Public Security Bureau to go arrest the whole village. So they're only good at arresting Yang Kang. You should you can't handle infant formula smuggling. You can't handle these issues. You should be stopping drugs at the source. Time's up. I'd like to use my 2 minutes to ask the Bar Association, driving under influence and drug testing for DUI. What is the legal reasoning? Did you agree with the drug testing for DUI? How do you compare the two scenarios? In the past, you said there was no immediate danger, But just now, a legislator said that a lot of drug takers, they can turn violent. They do create damage, serious damage. So how is that different from driving under influence? So I'd like to hear your legal perspective. What's the difference between the two scenarios?
Drink or drugs, as I said, he is an immediate danger to himself, to others, to property. The scheme envisaged by the RDT would have a situation where police would go into a bar. The people in the bar, the young people, may be quite passive at that time. But if there are these, he suspects there's drugs in the vicinity and the person is showing symptoms of drug taking, then he is taken for testing. Now, he may be quite passive. It may be some other time, another month, another year, another 10 years, that he may be violent. But when you have, interesting, when you have drink driving or driving under the influence of drugs, the person is tested because he is a danger. He is then, the results, he could be prosecuted. But there's no follow-up treatment. There's no mandatory treatment for alcohol counseling or forcible detention for counseling or for drugs.
好嘅，好啦，咁我哋今日嘅討論嚟。
Well, we have to thank the 4 deputations for providing their professional views. The ACAN has also participated, and I need to conclude this discussion, but before I conclude, we need to have to hear from ACAN. I'd like to put forward 2 points. Leung Kok-hong said we're wasting time, and we have to ask, why are we wasting time? The scenario we envisage is we have strong and compelling evidence. I won't go in depth. You can refer to Medical Front. They have a website. They say that if you look at patients with bladder or kidney disease, it's a race against time. We also have a gospel rehabilitation survey. 80% of their kids are on probation, and 70% of the kids in the rehabilitation center say that they are very fortunate that they were under this mandatory program. There's just a little supplement that I'd like to add. Some legislators asked whether the issue is very serious. Professor Sek had told us that drug takers' health is deteriorating and they might even face an early death. We aren't able to identify all the drug takers, but over the years we spent a lot of money and effort. We do see some improvement, but there are still a lot of people on this path of no return. So we just want to provide an extra choice for society. Just now, legislators also asked, is drug testing equivalent to successful rehabilitation? No. Drug taking is a serious issue. It's a public health issue. We have seen successful cases in the last few years. We know which people are drug takers. So aside from medical intervention, social welfare intervention is also very important. We have successful cases, and we feel if we intervene, we can help a lot of people from taking this path of no return. Some legislators questioned that we don't have sufficient downstream resources, but I'd like to add that in the last few years, we've added more resources to drug rehabilitation. some 87% of drug takers, they can find a bed space in a rehabilitation center within 2 weeks. And they can do so voluntarily. There is sufficient bed space. For female rehabilitation centers, it's 72%, and for males, it's 66% occupancy. So if we have new mechanisms, that's about all I wish to add. So the consultation will run till 23rd of January, and I'd like to urge interested parties to express their views so the government can hear more voices. So once again, I have to thank the 4 bodies for sharing your views with us, and I believe it will assist all our legislators. It will assist ACAN. It's very useful. So once again, I have to thank the 4 bodies and 4 representatives and ACAN. So this will conclude this item. Thank you very much. We now have to move on to agenda item number 5, and we'll conclude our meeting by 5 o'clock. The next topic is a follow-up on the quarterfinal appeal order in the judicial review case of W versus Registrar of Marriages. So attending this item are Mr. Lai Dong-gok, Mr. Billy Wu, and Mr. David Jiu Waigai, Assistant Director of Immigration Department. The last item overran a little bit. We will run till 5 o'clock, and I hope you can accommodate us. So could you take us through the paper first, and you can hear from legislators. In the W case, the Court of Final Appeal had ruled that Ms. W, who had concluded as the SRS, had complied with Marriage Ordinance 20(d) definition of a woman. Therefore, she could get married with a male.
And also on the 16th of July 2013, the court ordered that the definition of female or a woman in the law should include someone who has been proved by the doctor to have undergone sex reassignment surgery, but a transitional period of 12 months is given to the administration to amend the law. And the court also mentioned how we should decide on the sex of other transsexuals and what kind of legal problems they may face. Today I will introduce to you the follow-up work to be undertaken by the administration to the W case to implement the CFA's order, and that is to interpret Section 40(2) of the MO and also Section 21(1) DMCO, and the definition of a woman, and that it should include someone who has undergone full SRS. We propose to amend the MO to state, according to the court case, the concrete requirements of SRS, and that its applicability will also now apply to a woman becoming a man. In other words, the removal of the original genital organs and construction of some form of genital organs of the opposite sex, that these people should be able to register a marriage, and they will be identified as being of the sex to which the person has been reassigned, and so can undergo marriage with another sex. I must say that the proposed amendment will not affect the present marriage system in Hong Kong involving a man and a woman. After undergoing full SRS, a Hong Kong person has to provide the medical evidence so that they can make it clear in their ID that they are now in the reassigned sex. In order to obviate the necessity of producing a doctor's certificate in registering for marriage, we propose that in the amendment of the law, we will make it clear that the sex of any party to a marriage as stated at the time of the marriage in his or her personal identification document shall be prima facie evidence of the sex of that party. Would also include a clause to state that this amendment will not will not be affected by Section 21D of the MCO. And so the marriage would not be regarded as void because the parties are not respectively regarded as male and female. We would expect to propose the amendment in the first quarter to the Legislative Council so that we can complete our work within the 12 months given by the Court. And Mr. Chairman, the Court also mentioned other views in the judgment, and that is sexual or sex recognition. And it has said that maybe the administration should consider what is done in other jurisdictions in order to tackle the problems facing transactions in all areas of law by drawing over such reference. As for gender recognition, I think you'll understand that this involves complex legal, medical, and social issues, and it has an impact on different policy areas. So the administration has decided to set up a high-level interdepartmental working group to be chaired by the Secretary for Justice, with members comprising representatives of relevant bureaus and other appropriate members such as members of the legal profession. The purpose of the working group is to consider all views in the need to enacting legislation to deal with the various issues relating to gender recognition, and also to make appropriate proposals. At the appropriate time, the working group will conduct widespread consultation, including consulting all stakeholders. Thank you, Chairman. Okay. Members, would you like to make any comments? Ms. Priscilla Leung or any others? 4 minutes. Thank you, Chairman. I'd like to thank the Secretary for Security for introducing their follow-up work to the W case. In the law, if a person is certified medically that a person will live in society in an assigned sex, well, even if there is not such an amendment, according to the judgment, it is already effective by common law. And you are amending the law according to that kind of judgment. I think it is okay. But in the judgment, it is also proposed that Hong Kong should also make laws with regard to transgender persons. Well, I think this is very different from allowing people who have undergone SRS to get married. The judgment states clearly that if someone has undergone full SRS and lives in an assigned sex, then the friends, the family of this person, and other people related to this person know very clearly the assigned sex. But today I can see that some deputations are saying that you can go for a psychological aspect, and also even if people have not fully undergone SRS, those should also be considered. But I think that is very dangerous, and I will state clearly that I do not subscribe to that view, because my knowledge and also the views I have seen from society are that if transgender people are allowed to get married in Hong Kong, and if they are not fully reassigned as to sex, and if these people can choose to act like a male or female, I think there are many worries indeed. I believe the Hong Kong society would still like to preserve the present marriage system involving a man and a woman. Now, I agree that your present proposal does not threaten the basic marriage setup involving a man and a woman. But if you expand or relax the definition of a transsexual to include those who have only undergone half SRS, then there have been cases in the past whereby the friends and families of such persons, and in fact this happened overseas, that these people were using a changing room of the other sex. Other people were shocked. They did not find it acceptable. So a person has to decide on a sex he or she belongs to, and the person should not be able to choose his gender from today to tomorrow. Now, some people talked about gender X. Mr. Secretary, I hope you won't think in that direction. I hope you will just act within the narrow parameters of the judgment. Then there would not be so much opposition in society, and it will be easier for you to pass that amendment. Thank you for that comment, Mr. Raymond Chan, and then Ms. Sit Ho. Thank you, Chairman. I'd like to thank the administration for stating in para 12 of the paper that the administration attaches great importance to the CFA's comments and problems facing transsexuals. I have read all 13 paragraphs, and what will actually be done is only in para 8, that in the MO, the sex of any party to the marriage is stated at the time of the marriage in his or her personal identification document shall be prima facie evidence of the sex of that party. I think this is the lowest threshold you are going for. If you are just making this change, it will take just a month. At least in the paper, I have not seen what you have studied. First of all, is my understanding correct? Secondly, if this is just such a limited amendment, would that give rise to court litigation? Say, for example, if one party to a marriage changes his or her sex, then the original marriage would not be valid anymore. Is that right? Because it's not a man and a woman. And if the case is that one party of a marriage has already changed the sex before this case, would the marriage also become void? Would you tackle such problems? And also this high-level interdepartmental working group. Can I ask which bureaus will be involved? What about FHB and LWB? And you talk about other appropriate members. Who are these people? Do you have a timetable? If you say within a certain time, I don't know how long that means. Secretary. Thank you, Chairman. Mr. Chan, you say this can be done within a month. We have looked into it. It cannot be done within a month. The amendment will be done according to the CFA judgment. But when it comes to the actual wording of the amendment, we have to act with caution. We don't want the writing of the text to give rise to other legal problems. And also when we come to the Bills Committee of the LegCo, we would be alerted to the fact that there are many things that we have not considered. I hope you will understand that is not just a short time or long time, but we want to do the best. Mr. Chen asked whether this will give rise to litigation because a man and a woman will get married, but one party eventually undergoes SRS. Our understanding is that under the MCO, under 20 bracket 1 bracket D, it is said that these people can apply to nullify the marriage. We believe the law already tackles the situation. We also know that in the UK, there is law saying that if someone undergoes SRS, but he has not got the reassigned sex, then first of all, he has to nullify his marriage first. Well, they have civil unions in the UK and they are still protected. So I still like to clarify. If somebody changes his sex after a marriage, you say it can be nullified. But if they don't do it, they don't apply, are they still protected by the law? And can a third party apply to nullify that marriage? As I said, the marriage would not become void automatically. The marriage is a kind of agreement. This is my understanding, is an agreement entered into by a man and a woman. If someone wants to revoke the agreement, then either party should act according to the law to invalidate the marriage. Mr. Chairman, can you allow me to answer the third question? No. Ms. Sit-Ho. Chairman, para 9 of the paper is exactly what the Secretary should address. You cannot shirk that issue. 2 persons would register to get married, and after that, one party undergoes SRS. The ID card contains the reassigned sex. And of course, on the marriage certificate, it is still a woman and a man. But after the SRS, both parties could be male or female. In para 9, you cannot just muddle through to say that according to 21D, this is already addressed, but you write it in such a way, and you say, lest that marriage shall be void on the ground that the parties are not respectively male and female. So what are you talking about? I now give you the time to explain yourself. Is it going to be void or valid?
We have sought legal opinion. After reassigned sex surgery and after changing of ID sex, it would not lead to an automatic void of a marriage. So under these circumstances, if any one of the parties wishes to annul the marriage, they need to undertake the procedures to annul the marriage. Okay, it will not be automatically void. So in this family, if we have a same-sex family apply for government housing or apply for home ownership, how will you handle these applications? Will you acknowledge a same-sex family? Well, of course, we would support such an application. So after the legal amendment, there are other problems arising. So the Secretary for Justice will convene a interdepartmental group. So Ms. Ho, even though the question you raised is not my ambit, but my understanding is that if we have 2 people in a family, and when they applied, they were a legally husband and wife, and let's say they still have a valid marriage even after a sex reassignment surgery, well then I would like the Secretary to take his understanding and share it with the Executive Council and other bureau, and not and we hope to not see new cases arising and judicial review arising. So when you amend this law, then other laws that are affected from this amendment cannot be avoided. So I'm not trying to avoid the question. I mentioned that the Secretary of Justice has convened a high-level interdepartmental group, and they will study a whole range of issues. That's why we need to consider these things. But we only have 12 months. Within this year, we have to draft this bill. And even if we can't, the court ruling will still take effect. So we are dealing with this. The Secretary for Justice will convene a high-level committee. Will invite the legal experts. Ms. Ho, you just raised. There are also under the Inland Revenue Ordinance, the spouse so a person who has undertaken the sex reassignment surgery under the marriage ordinance, they can make the amendments. So people who have undertaken SRS under the new law can amend their sex in their ID card, but other people will not be affected. Is my understanding correct? Let me attempt to understand your question. Paragraph 7 says, if a person has undergone SRS, let's say from a male to a female, and after changing the ID, the sex of the ID card, they wish to register in a marriage, they are registering as a female. And of course, they have to get married with a male, if that's all. I understand that. That's all paragraph 7 says. So, in the CFA, paragraph 124, 125, 129, it also says, so aside from SRS, people will be affected by this ruling, aside from those who had undergone SRS. But that does not affect transgender people after the SRS. The CFA ruling says that it wishes the legislative arm to consider legislating. For example, in the UK they have a Gender Recognition Act to deal with these arising questions. So I urge the administration to undertake a comprehensive amendment, not just targeting SRS subjects. So if your legislative proposal is just limited to paragraph 7, then I'm worried there would be more judicial review cases regarding people who have not undergone SRS but have people who might have undertaken SRS outside of Hong Kong and people who might have undertaken partial SRS. So that is why the CFA has asked the Legislative Council to ask us consider drafting a gender recognition ordinance. So I wish you could look into this. You are correct. In paragraph 124, the court says, let me they want to leave it open. So if the executive arm feels that it needs to be dealt with, they will come to the legislative arm. And all these related questions will be dealt with by the high-level interdepartment committee led by the Secretary of Justice. There are other issues arising, and they need to be inspected. I have a friend who has undergone SRS. That's Ms. Sid Ho's case. So what are their rights? of course, they don't need to apply for public housing. They have changed from a male to female. So if the marriage is not annulled, so are they still in a marriage? So the common law marriage is maintained unless it's annulled. This is the requirement of the Hong Kong Marriage Ordinance. Please allow the official to respond first. Hong Kong law, if a male and female have a legal marriage, so before it is annulled, the marriage is still valid. So under the MO, the rights are safeguarded under the MO, Marriage Ordinance. So you can't say that because there's a sex change that the marriage is not void. So your understanding is, even though there is a sex change, they've completed, they have just removed the genitals, but they have not reconstructed the female genitals. The amendment we're dealing with is a person who has completed SRS and they have a new, they wish to register a marriage under a new gender. Your question was a valid marriage, man and a woman without any surgery, and subsequently one party underwent SRS. Is that marriage still valid? Will that affect their existing marriage and the rights enshrined by the marriage? We have sought legal opinion. The marriage is still valid. It will not be automatically void. So from that basis, if they have not completed the whole SRS, they have just removed the male genitals but have not constructed the female genitals, they have not completed the SRS. So when the legislation takes effect, they are not viewed as a real female. If a person has not completed SRS, and even after the legislation takes effect, their sex has not changed legally. So up till now, if they haven't completed SRS, they haven't constructed the female genitals, they are still considered a male. Is that what you mean? Yes, okay. We have Mr. Mok Lai Gong and Jie Wai Jun who wish to speak. And in the second round, Ms. Priscilla Leung and Tan Ji Chun or Sid Ho. So we cannot complete unless we all agree to extend. But if we extend 4 minutes and in the second round we'll allow 2 minutes. If one person cannot accept that, then I'll have to conclude at 5 o'clock. If there's any objection, we'll have to conclude at 5. Any objection? Can you accommodate us, Secretary? Mr. Mok Lai Gong. 4 minutes. The professional union have a paper. We had conducted a study. Our suggestion is to support the gender recognition, and in paragraph 11 it states very clearly that the CFA requests that we consider the UK Gender Recognition Act, and I agree with Mr. Kwok Wing Hung. If we only comply with paragraph 7, it is not complete. It is not in compliance with the CFA. Another question I have is the government will there will be a high-level government department to look. They will invite legal professionals. How do you identify these people? And what other people are you trying to recruit? Will you include the affected people, the transgender, the SRS subjects? And you said you need to balance their interests, but they are the ones being affected, so you should attach importance to their views. We have legal professionals who have conducted studies into gender recognition. Will you invite them? That's a very good question. We have stated in the paper that the CFA ruling has an instruction regarding subjects who have completed SRS and their new sex. We will legislate accordingly. So aside from that instruction, the CFA also spent a lot of ink on suggestions. For example, the UK Gender Recognition Act and so on. Because of this, we need to look at it very thoroughly, so the government has decided that the Secretary of Justice will convene a high-level interdepartmental group to look into this matter. So the UK spent 6 years on this, and at the time they had a similar level official who conducted an interdepartmental review and consultation. So we are adopting the same direction. Each country is different, so our study will have to be in depth. Other legislators asked which departments will be involved. I can tell you we have in mind the Constitutional Mainland Affairs Bureau, because they deal with human rights and will also include food safety and health. What about, because it was mentioned that there are some people who have only partial SRS, we need medical experts. We need their participation. We also have a Home Affairs Bureau. Ms. Sid Ho mentioned husband and wife, their rights and obligations. We also have the Social Welfare Bureau. They will have to attend, and the Security Bureau will also be present. And the Secretary of Justice is now identifying suitable.
We have not decided on the composition yet, but Mr. Mark's view will be related to the S for J. We have promised that we will start work in the first quarter. And first of all, we need to set the terms of reference and scope of work of the working group. I expect the working group to conduct wide consultation. Anybody who is interested or who thinks they may be affected will be given ample opportunity to be represented. Mr. Paul Chair, thank you, Chairman. Society has to move forward, but this is still an issue relating to a minority. However, it involves legal amendments, so I would agree that we should tackle the court decision first and do it as a first step, and the rest should be examined with more caution. I agree with that in principle, but I have a few questions. Number one, if someone has undergone full SRS and he registers for marriage, then the sex in the ID will be the prima facie evidence. I'd like to know whether you look at other kinds of evidence. Number two, at present, any change in the ID should be notified to the administration unless with reasonable excuse. Now, if someone has undergone full SRS, is it absolutely necessary for this person to change his sex in the ID because there will not be any reasonable excuse? Number three, a related point. I'd like to refer to the case cited by Mr. Leung Kwok Hong. Somebody has undergone surgery, but the reconstruction, or actually the marriage has not become invalidated, and he has not changed his sex in all other legal documents. Now, is it that this person has to undergo all the procedures so that the administration will allow him to change his sex in the ID, so that there will not be the creation of other inconvenience? For example, if he changes the sex in the ID but has not voided the marriage, then there may be a problem. Secretary, can I defer to my colleague, Immigration Department? Thank you. The first question. We propose the amendment, and we would say that the ID will be the evidence, meaning when someone applies to register for marriage and we see the ID showing a man and a woman, then we can accept the application. But if in our record the person is not a man or a woman, then we would have reason and we would need to clarify with the applicant. The applicant would be asked to provide evidence as to whether he has changed his gender. Second question, whether we would ask the person to change his ID before we would let him register for marriage. The legal view is that we have reasonable grounds to insist that the ID should be changed first. Is it absolutely necessary? Does he really have to change the sex in the ID? Well, according to Section 18 of the Immigration Ordinance, if there is a change in the ID, that person should immediately declare to the Registration of Persons Office. If he doesn't do so, he contravenes the law under Section 19, and we can prosecute this person. As to registration for marriage, if we should see that there is inconsistency in information, then we can ask the person to first change the ID first. Second round, Ms. Priscilla Leung, Sit Ho, and also Raymond Chan, 2 minutes each. Thank you. I'd like to tell everybody, including the Secretary, that there is not a lot of reaction to the judgment because it is very clear. The person has to undergo full SRS, and there should not be any mixing up of his reassigned sex. So people who are related to him should know exactly which sex he belongs to. But I, of course, have handled cases where the spouse or the children have collapsed because they cannot accept the new sex. In fact, it is important to know the impact on people around him. I think they really need to talk to people who are closely related to the person. You cannot just think about this person. Just now, the Secretary said that there would be a working group. You should not only include legal professionals. Now, certainly, you should allow legal representatives on the working group, but I would urge you to also think about the existing situation in our society. Actually, many people do not subscribe to the judgment, especially the proposals made by foreign judges. They are not aware how many people object to what they are saying. And also, have they imagined what will happen if we follow their advice? And in fact, that would go against the mainstream view in Hong Kong. If the interdepartmental working group would be led by the DOJ, you should not just include legal people, or else you will be dealing a blow to society which will be bigger than the constitutional reform. Mr. Raymond Chan, I'd like to ask the Secretary a very simple question. According to the existing ordinance, the gender in a marriage certificate should be according to the birth certificate, but in the end you have to change according to the ID. In other words, people will just have to show their ID instead of the birth certificate. Is that right? And also, if they can get married now according to the birth certificate, then they should do so now instead of waiting for the amendment. First question. If somebody has undergone full SRS, he is reassigned another gender, so he can change the ID. But the birth certificate is actually only a copy of the birth registration. Now, this is a register which records a fact, and that is on a certain day, in a certain month, in a certain year, at a certain hour, a baby was born, and the father was so-and-so, and the mother was so-and-so. This is a fact that will be recorded. Perhaps the Immigration Department can supplement. Within 12 months of the birth, if there are typographical errors, those could be rectified. But that's the end of it. But if somebody undergoes full SRS, we are talking about adults, and they can change the ID. But then the birth certificate will not be amended in any way, because the birth certificate only records the fact at birth. In other words, after the amendment will come into effect, marriage will be based on the sex in the ID. Yes, we will not ask for the production of the birth certificate. Okay, Ms. Sitho. Chairman, I hope members will understand that the rights of the minority should be protected and defended by the majority, who should be magnanimous. They should not be deprived of those rights by the majority. I think this is what human rights are about. I will ask the Secretary to talk to the administration. When you set up the working group, you should include a big area of work. Mr. Justice Bob Curry has said that there should be equal rights for the genders. You are acting according to the judgment, and you only establish the right to marriage for people who have undergone full SRS. But then there are still many problems that remain unresolved. Even medical doctors won't agree that as long as somebody has undergone full SRS, they should be recognized to have a new sex. I think we all have to face this problem, and I hope you will take back this message. Okay. Any response? Yes, please. Just like to clarify something. Ms. Sitho's view will be related to the working group, but I have to state it clearly here that the W case is such that the parties and also the court have stated that this has nothing to do with marriage for people of the same sex. Okay. I believe we should end the discussion of this item here. I thank the Secretary for coming. Last item, under AOB. There is nothing under AOB, and the meeting is adjourned here. Thank you very much for attending. Thank you.